Sve ono što smo radili u interesu.
Out of Croatia, which has just been hit by a strong 6.4 magnitude earthquake. Local media is reporting the town of Petrija is at the epicenter. That's around 50 kilometres from the capital, Zagreb. Widespread damage to buildings is being reported, but as yet no casualties have been confirmed. Now, the earthquake was felt in neighbouring Bosnia-Herzegovina as well as Serbia, and neighbouring Slovenia has also shut down a nuclear power plant as a precaution.
Buildings collapsed, lives destroyed. The extent of the damage in Petrinja and surrounding villages is becoming more clear as emergency workers search for anyone who may still be buried under the rubble. The 6.4 magnitude earthquake struck on Tuesday and was felt as far away as Vienna and Munich. A series of strong aftershocks and the potential collapse of more buildings have forced many to seek shelter outdoors.
We live in a flat
in Petrinja in a building that's heavily damaged and it's not safe anymore to be there. We have a camper van in the village and we've spent the night in it. It's a bit better now because we have electricity so we can stay warm.
We're very afraid. It's chaos in the house. It's not destroyed, but everything is broken. All our stuff fell out of the cupboards and was broken. We spent the night in the car, but we couldn't sleep at all. We have 2 children and I don't know what to do.
The towns of Petrinja, Glina and Sisak were the hardest hit. Some have returned to their homes to find little more than debris, forced now to create makeshift shelters from the bitter winter weather.
A major search and rescue operation on this snow-topped hillside, just 25 kilometres northeast of Oslo. Hundreds of people have been evacuated from an area that's prone to so-called quick clay slides, though this is by far the largest in recent years. Norway's Prime Minister visited the area to assess the level of destruction for herself.
Først og fremst mine tanker nå hos alle de som direkte berørte. Det mange som fortsatt ikke gjort rede for. Dette en stor katastrofe.
Quick clay is common in this part of Scandinavia and turns fluid when it becomes overstressed. Neighbouring Sweden has offered to send its own specially trained personnel to help with the rescue effort. This as masses of earth continue to move around the crater. Some of the houses that had been teetering on the edge did eventually fall in as the day went on.
Så jo raset som sagt I bevegelse, og dette har resultert I at det flere hus som har gått ned og inn I denne røde zonen, men dette boliger som evakuert. Og det da 3 hus som har falt ned I denne røde zonen.
The authorities are still trying to confirm exactly how many people could be trapped under the mud and debris. The landslide hit overnight when people would have been home, but some have already called in to say that they were away for the New Year's holidays.
The waters had risen again overnight. Large parts of St Neots in Cambridgeshire resembled a lake. A major road into town cut off after the River Great Ouse broke its banks. In the centre of town, it was around midnight the waters came up. By 3 a.m, it was inside Gina Rutford's house, leaving Gina and her son Samuel desperately scrambling to save their belongings.
this afternoon that the Civil Protection Unit in Zimbabwe has started evacuating people in the eastern parts of the country, most vulnerable to Tropical Storm Shalane.
ama 1 yega ma 1 bridge apasina road inobva chimani yakananga kuwengezi mutare mabridge.
Yeah, I'm Friday, man. Last saw this when I was in high school, I think. Yeah, tukikokazara.
Historic decision ending the criminalization of abortion in this mostly Catholic country. After a long debate, women outside Congress waited anxiously for the vote to happen. And when it did, there was pure joy among those campaigning for that result.
We have friends affected because there are no legal and safe abortion, and it's a debt that we have as a society. The state needs to deal with this issue. We couldn't just continue ignoring it. I'm so happy.
The debate lasted for about 12 hours, and the bill was turned into law with 38 votes for and 29 against. The bill legalizes abortion in Argentina up to 14 weeks into pregnancy. It allows women to get a free abortion in a public hospital and will end the fears women have of being reported to the police if they try to terminate a pregnancy.
Women in Argentina have been campaigning for years to legalize abortion in this country. For these women, it's a matter of public health because already around 500,000 abortions are carried out every year. Many of them end up with complications. Thousands of women end up in a hospital because of those complications. So for these women, legalizing abortion is crucial to save lives.
But not everyone celebrated on Wednesday. Andy Aquino couldn't help crying when asked about the possibility of legalizing abortion.
We're going to cry a lot. There are a lot of lies. They want us to sell something that is not true, that abortions happen everywhere. We poor women do not want to have abortions. We love our children.
The Catholic Church is a powerful body here. Pope Francis is Argentinian and has been lobbying against the law. Mariela Bielski says the Church needs to adapt to current times.
And he sent letters here to say what he thinks and to try to influence. So I think there is a difference. And for the Church it's very important not to have this law passed because they need to maintain the Catholic movement very high in Latin America, double standard. He tolerates abortion in the North and in Europe and United States and in Canada, but he doesn't tolerate abortion in Latin America. So I think he needs to do some reflection about it.
The vote in Argentina sets a precedent in a region that has some of the toughest laws against abortion in the world. But this movement of women's groups has spread throughout the region and has become a force for change. Teresa Bo, Al Jazeera, Buenos Aires.
Welcome to the News Hour. We start in Yemen, where several people have been killed in an explosion in the southern city of Aden. The blast happened as members of Yemen's new unity government arrived at the airport. The ministers have all reportedly been transferred to safety. Yemen's Minister of Information is blaming the attack on the Iran-backed Houthi rebels, but they say they had nothing to do with it. Let's join Mohammed Al-Atab, who is our correspondent in the Yemeni capital. Sana, what more do we know about what seems to have happened and the circumstances around the blast?
Yes, according to my speak on to the sources on the ground, the media people there witnessed that the fall down of 3 missiles from outside of the airport. So a number of people have been killed and also others injured as a result of these attacks. The head of the parliament has called on the government, all the members of the government, to come to aid in order to send a strong message to those who try to sabotage the Riyadh's agreement, that this agreement would be implemented on the ground and that the government would return back despite of these attacks. The government people, the members of the government who have arrived to Aden have been transferred to a safe place. Also, the Minister of Information, Muammar al-Iryani, blamed the Houthis, while here the Houthis have condemned such attack on the airports. But according to experts or observers, they say that there is the fingerprints of the tools of the United Arab Emirates, who wants to keep the situation as it is, and that wants to continue its control of Aden and also the coastal line along with the Strait of Bab el-Manda, which is an important pathway for fuel ships. So we couldn't till now figure out who is responsible behind these attacks and what is the message that they want. As according in a number more than one occasion, the government tried to return back to Aden, but several attacks and confrontations have taken place. Hopefully this last agreement, which has been stricken by all the parties, would be implemented on the ground in order to put an end to the political vacuum in Aden and also in Yemen.
In the early hours of January 3rd, 2020, shortly after arriving at Baghdad International Airport, Major General Qasem Soleimani was killed in a U.S. drone strike. His close ally, the deputy head of Iraq's Popular Mobilization Forces, Abu Mehdi al-Mohandes, also died along with 8 others. Missiles from the U.S. drone hit their convoy as it left the airport. Soleimani was the commander of the Quds Force, a unit of Iran's Revolutionary Guard responsible for foreign operations, and he was also considered to be the second most powerful man in Iran, behind the country's supreme leader, Ayatollah Ali Khamenei. The news of his death made official by Iran's state TV. A 3-day mourning period was announced, and Iran vowed revenge as U.S. President Donald Trump stood by his decision with this claim.
Last night, at my direction, the United States military executed a flawless strike that terminated the terrorist ringleader responsible for gravely wounding and murdering thousands and thousands of people and hundreds at least of Americans. Qasem Soleimani has been killed, and his bloody rampage is now forever gone.
For Ayatollah Khamenei, Soleimani was a trusted confidant, a member of his inner circle, and a friend for more than 30 years. Almost 12 months on, the commander-in-chief of Iran's armed forces says he's not done avenging Soleimani's death.
Whenever it's possible, we will take revenge. We will take revenge on those who ordered Soleimani's assassination and the ones who carried out that assassination.
After a year that shook humanity to its core, forcing people to rethink their basic social interactions and decide on a daily basis what risks they're willing to take, vaccinations have been discovered and they're finally being deployed. But what happens now? The United States still has the highest number of infections and deaths in the world, and the numbers just keep climbing. Almost 19 million Americans have been infected. At the moment of this broadcast, more than 121,000 Americans are in hospitals. The death toll has eclipsed that of every other country, with more than 330,000 families grieving the loss of a loved one. Scientists warn that this holiday season, we're going to see even bigger spread of infections and that we should brace ourselves well into the next year. So when are things going to get under control? Today, we talk with one of America's preeminent scientists, Dr. Anthony Fauci. Dr. Fauci, you don't need an introduction, but please bear with me as I tell our audience that you've been head of the National Institute of Allergy and Infectious Diseases since 1984, and now you've agreed to become the chief medical advisor for incoming President Joe Biden. Do you see a light at the end of the tunnel in this? What should Americans be thinking and doing right now? What's your message to them?
Well, Steve, there's certainly light at the end of the tunnel, but it's interesting. It's bittersweet because we are still here in the United States in the middle of the worst possible situation where we have a couple of 100,000 cases per day. We have about 2,000 deaths per day. And just yesterday, we broke yet again another record of hospitalizations with 121,000 people hospitalized for COVID-19. So we are in a very difficult situation. We are now in the middle of the Christmas, New Year's holiday. There had been significant travel. We've seen the pictures on TV of airports crowded, of people going to and fro for the holidays. And then there will be congregate settings where people go to dinners. So we can expect that things will likely get worse as we go into January from the standpoint of the lag that you usually see by a couple of weeks between cases versus hospitalizations versus death. Having said that, December, besides being the worst month that we've had throughout the outbreak, is the beginning of the era of vaccines, because we now have vaccines that are already being put into people's arms starting this month, and it will accelerate as we get into January, February, March, and April, with the priority groups being vaccinated. First, healthcare providers, people in nursing homes and those who care for them, then critical people in society, people over 75, and on and on. By the time we get to March and April, where I use the terminology, Steve, as open season, namely that anyone who wants to get vaccinated can get vaccinated. By that time, hopefully, we will have, by contractual arrangement, the hundreds of millions of doses that will be necessary to vaccinate, which, as I've been saying, we really want to aim at getting anywhere between 70 and 85% of the people in the country vaccinated. So again, challenging times right now as we speak, but encouraging times because vaccines are starting to be rolled out.
About 20%, maybe 30% of Americans are resistant on the notion of taking a vaccine. Can that be ignored? Can the rest of America get vaccinated, and can we achieve an overall equilibrium of health without regard to those that don't want to participate?
Well, it's sad that many people don't want to do it. I've been saying, and my epidemiology colleagues agree with me, that in order to achieve herd immunity, you need somewhere between 70 and 85% of the population to be vaccinated. So I would like to see a very small proportion of people not vaccinated. I'd like to see everybody vaccinated, but I think in reality, to be realistic, I don't want to see a large proportion because that would hinder our attainment of herd immunity.
And finally, when we reach the next holiday season of Christmas and Hanukkah and Eid, are families going to be able to get back together again? Are we going to see a return to some semblance of normality, of being able to be around the table and in rooms with the people we love?
The answer to that in my mind is yes, but there's an if there. And the if is if we actually get enough people vaccinated that we can bring the level of virus in the community so low that it's no longer a threat. So if we get to herd immunity by the end of the summer, the beginning of the fall, I believe that we can have what would appear to be and will in reality be a normal Christmas, a normal Thanksgiving, a normal New Year's a year from now.
Extending the vaccination program under pressure over new figures. Russia is now offering its own Sputnik V vaccine to frontline workers such as doctors and teachers over the age of 60, as well as to younger colleagues. According to data from the National Statistics Agency, around 26,000 people died due to the coronavirus in November alone. In response, the Deputy Prime Minister has said authorities have never hidden any data on COVID-19 mortality rates. In Portugal, this nurse was one of many health workers getting a COVID-19 jab at Lisbon's largest hospital. The country hopes to vaccinate nearly 10% of its population during the first phase.
I think it's part of our civic duty to try to prevent the pandemic. As with measles and other viruses like influenza, that's it.
In Spain, Monday's front pages were all about the start of the vaccine rollout. But Pfizer's postponed the delivery of a new batch by a day due to what the government's calling a logistics hurdle. Spain's health minister says vaccines will be available to the public on Tuesday morning and predicts 70% of the population will have been immunised by the end of summer 2021. The main worry for people arriving at this ski resort in central Germany was getting stuck in the snow, not the coronavirus. But the national vaccination campaign is facing delays in several cities because temperature trackers showed hundreds of doses may not have been kept cold enough during transit. It comes as UK healthcare officials sound the alarm. Health authorities say there are now more COVID patients in hospitals in England than during the previous peak in April. The government says reopening schools in January will involve trade-offs with other restrictions. But its own scientific advisors have reportedly said any national lockdown in January would have to include all schools to prevent the virus spreading exponentially. And asked whether teachers will soon get the vaccine, Cabinet Minister Michael Gove was non-committal.
That we prioritise those who are most vulnerable, the eldest and those with other challenging conditions, and then we make sure that the vaccine can be distributed more broadly.
The UK is hoping to get approval for a second vaccine developed by AstraZeneca this week, so it can start administering it early in the new year. But it knows that will only be part of the solution to a still growing crisis.
Gearing up for the world's largest immunization campaign, these healthcare workers are taking part in a nationwide drill to test the delivery of vaccines. 300 million Indians are due to receive injections in the first half of this year.
It's a mock drill, just preparedness for further vaccine coming.
We're not worried. To get rid of this pandemic, we have to get injected. I've been working in public health for the past year, and I want an injection, and to motivate others to do the same.
India's drug regulator has received a recommendation for approval for the AstraZeneca Oxford University vaccine for emergency use. It can be stored and transported under standard refrigeration. That gives it an edge over those that need to be stored at extremely low temperatures. It's also cheaper than the alternatives. Tens of millions of doses have been stockpiled and will be given for free to healthcare and frontline workers in the first phase. And more are being acquired fast.
India is perhaps the only country where 4 vaccines are getting ready at one time.
And those others include Covaxin, a locally developed vaccine from Bharat Biotech that has been recommended for emergency use by a panel of experts. But many are asking whether the vaccines will be effective or reach the right people.
We don't know how long the duration of immunity lasts. We don't know when they will reach people like vegetable vendors or, for example, fish sellers or in the marketplaces or in the manufacturing hubs where the spread occurs significantly in India. I'm not sure that the problem has been appreciated or the response is robust enough, because these groups which are being vaccinated are not really going to spread transmission within the general population.
The Serum Institute of India has partnered with the UK-based drug maker AstraZeneca to produce 1 billion doses for low and middle-income countries. But the anti-poverty charity Oxfam says 9 out of 10 people in the world's poorest places may miss out on a vaccine this year.
Openly flouting social distancing rules, thousands of football supporters gathered in the streets to celebrate the local championships final. It was the latest infringement of restrictions in the Colombian capital, just as the mayor said the city has officially entered a second wave of COVID-19 infections, while at the same time announcing new measures for the end of the year.
I need to insist to Bogotanos there will be no public parties, no selling and consuming alcohol on December 31st and January 1st. If you get together with family, please only the closest circle.
Colombian authorities are also concerned that intensive care units are again at capacity in a number of regions, and doctors are sounding the alarm, especially since the country will not start vaccinations before the end of February.
There is an issue of the government improvising. We are at the tail end in Latin America with Guatemala. We will start with the Pfizer vaccines, but will only be able to do the vaccination in major centres like Bogotá or Medellin, not in remote areas, and we haven't bought enough vaccines.
But other countries are moving faster. On Tuesday, Argentina started vaccinating its healthcare workers with the first 300,000 doses of the Russian Sputnik vaccine.
Dileka Hempe and her brother Lulama Nabo buried their sister a few weeks ago. They said Lindiwe was struggling to breathe, but she didn't immediately go to the hospital, thinking whatever she had wasn't serious. When she eventually got tested for COVID-19, it was too late. By then, another sister was also gravely ill.
The younger sister was still in the hospital in ICU when the elder one died. We were still praying for her to survive, but then there was this blow of the elder one dying while we were still praying for that one to survive. And we were worried that that one, when she comes out of the hospital, she would be told that her sister is no more.
Nomtete Lelosiko died a few days after her big sister Lindiwe. South Africa's coronavirus infection total since the first case in March is now more than 1 million. During the festive season, thousands of South Africans travelled across the country visiting friends and family. Some attended large gatherings without wearing masks or practicing social distancing. That's why health experts say they are not surprised by the rise in numbers. Port Elizabeth is a coronavirus hotspot in the Eastern Cape, one of the provinces where the new variant was identified in South Africa. Doctors and nurses say the sharp increase in infections is putting more strain on already struggling medical facilities. The new variant has also been identified in other parts of the country. Several hospitals and medical centres say many wards are full. There is a shortage of ventilators, ICU beds and staff.
Certainly with the second wave, we've seen more healthcare workers also unfortunately dying from the disease. So the burden is a heavy one. You lose people you work with for years, but still you have to continue. You have to continue. There's not enough time for grieving.
South Africa's President, Cyril Ramaphosa, has tightened COVID-19 restrictions, banning alcohol sales, extending a nationwide curfew, and making the wearing of masks in public a legal requirement. So far, most people in South Africa who've tested positive for COVID-19 have recovered. But some doctors say, unlike in the first wave, when the elderly were most affected, this time they're seeing more young people in their 30s and 40s getting seriously ill or even dying from the disease.